All right. I think we can start. We have a few people here. Thank you everybody for joining on time. And thank you to Arundati and Dilip also for being here. My name is Yashna Jham, and with me I have Akshay Rungta. We're both co-founders of this organization called Uloy Labs, and we're very, very happy to welcome you all for the webinar, which is on, as you can see, evidence-based approaches to um, SRH education and menstrual health. And the idea is for us to cover how data gets translated into action. So that's what we're going to talk about today. And the idea, I mean, why we're doing is because at Uloy Labs, we're passionate about leveraging qualitative data and essentially using that for change. We've been doing some of the work for about 5-ish years around this in this space. And today's discussion will focus on how these approaches around evidence, powered by different diverse forms of data, can actually inform impactful interventions in these spaces. So we believe the webinar is timely as it is as these topics are central to advancing health equity and amplifying community voices. So over the next 1.5 hours, we'll explore what our speakers are doing. And we were supposed to have 3 speakers, but unfortunately, Namita could not join us today. So we'll just essentially talk to Arundati and Dilip, who have thankfully spared their time and with us today. So just going to introduce them very quickly and then jump into what we are covering for the day. Dr. Arundati is a co-founder of Menstrual Health Action for Impact, also MHAi. Arundati is a public health professional with 2 decades of experience in programs, research, and policy advocacy, particularly around menstrual health, WASH, and social determinants of health. And Dilip is the founder and board member of Uninhibited. And Dilip has over 15 years of experience driving systemic change in public health and gender equity with an impressive track record of impactful initiatives and global coalition building. Thank you once again to both of you for taking this time out and speaking to all of us. I think a lot of interest came in even when people heard about this webinar and we got a lot of interest and registration. So I suppose and hope this conversation is going to be useful for many of us, and especially us. We're very fascinated about learning from you all. We feel there's a lot of knowledge that's going to get unpacked today. Well, what we're going to cover today, I'll very quickly run by some key topics that we've decided. And also just for everybody, this is a very it's not like a presentation kind of a structure. We're going to have a conversation with Arundati and Dilip. So while we have some topics defined, it might go into different directions as well. So what we want to cover today is how evidence, especially qualitative data, that's something we can also spread in terms of what kinds of data, but drives decisions in the sectors of SRH and menstrual health management. The second is amplifying community voices to create impactful and inclusive programs, translating data into actionable insights for diverse stakeholders, ensuring ethical and responsible use of data in sensitive context, and innovation and future directions for evidence-based approaches. We know a lot of other interests and topics came in when we looked through the suggestive questions that were shared by you. But we may not be able to cover all, but please feel free to share your questions in chat also. So these are some housekeeping notes. We encourage you to stay engaged, ask questions. You can drop your questions in the chat box or even save them for a Q&A session, which is at the end of this conversation. And as Akshay said, when a few of you had joined, the session is going to be recorded. So we'll be sharing it with you all post the session along with any resources that are shared during the webinar. So yeah, I think with that, we're going to get started. That's about our presentations for the day. We don't have any deck. It's just going to be an open conversation as we shared. And I think we can just stop screen share, I guess. Thanks. Super. So thank you once again, and let's get started. We have a few topics and we have some time to cover. So just to get us started, question to, just 1 second here. Question to Arundati and Dilip, I think, to start us off, while you can share some of the work that you are also doing, but just to start us off, how does evidence shape your work, particularly in menstrual health, and anything more than that you've been doing, and can you share how qualitative data complements other data in driving any kind of decisions, essentially?
Go ahead, Dilip.
Thank you, Arundati. Hello, everyone. A little bit of context to the work that we do at Uninhibited. We are about a 10-year-old organization. We started off with sanitary pad distribution back in 2014 and have evolved to now strengthening government healthcare systems or adolescent healthcare systems to implement menstrual health interventions. And we strongly believe that improving menstrual health will lead to improved health outcomes for people who menstruate. So how do we really implement evidence-based effective solutions that could help us prove to the world that menstrual health is an important area to invest and prioritize, and also look at how can we integrate these solutions and government healthcare solutions as the crux of our work. So we have nearly worked with about 400,000 plus women and girls and other people who menstruate over the last 10 years. And majority of our work currently is centered in Karnataka and Maharashtra today. So glad to be here and share our learnings along the way. So to answer your question, Yashna, I feel because we started very early in the menstrual health space, there has been an immense need to just convince stakeholders around that menstrual hygiene then and menstrual health and hygiene or menstrual health today is an important area to invest. So evidence has always been a critical component of how we look at work and why we think it's important. But along the way, also, I feel we have kind of moved from we need to build evidence to convince donors to give us money. We need to build evidence to convince government to prioritize menstrual health, to now really look at how can we really build evidence that will help everyone across the ecosystem to be able to make decisions, including people in the communities and adolescent girls. So now evidence building has become part of a product design in a way where we don't look at evidence building as a separate exercise where we implement our intervention and then do baseline and line to measure the effectiveness and then publish reports about it. But how can we really design our programs in a way that will help stakeholders on the ground to reflect on probably their needs and their actions so that they're able to really do something about it, is the crux of. I wouldn't say we have come too far along, but I would say that's just necessarily become the philosophy of evidence building within the organization, where it's not just about digging insights or listening to insights on the ground, but how can we really listen to power structures and decision-making structures on the ground that will help us move forward effectively, collectively, is generally a philosophy that's kind of something that we are kind of nurturing within the organization. And also rightly so, because with menstrual health and sexual reproductive health, often we see these as technical issues of how many people have access to contraceptives, how many people have access to sanitary pads, toilets, but it is an equity-centered issue that at the crux of the multiple researches and studies that have proven that access does solve the problem, but most often just access to services doesn't necessarily improve the overall situation of stakeholders on the ground, because most often these are cultural issues, these are societal norm issues, these are issues that are driven by power dynamics and decision-making structures. So, and And there, I think the role of qualitative data becomes critical for us to be able to understand why a particular solution is working or not working, or what more needs to be done, or rather who needs to do something differently, because quantitative data often limits evidence building to individual behaviors on how an individual is receiving or using a particular service or a product or not. But as soon as we listen to their story, we suddenly realize that it's not just their behavior or their actions, but it's a system around them, and they're part of a larger system where they need to engage with. And they're like, particularly with menstrual cups or contraceptives, there are some really classic examples around how quantitative outputs establish that there is increased adoption, but when you actually go in and dig in, they say most of the adolescents are feeling uncomfortable using menstrual cups, or feeling unsafe using, or they don't have the decision-making ability to really use those services. So how do you really use qualitative data to amplify what's the real issue within the menstrual and sexual reproductive health spaces? Is a question that we often kind of revisit. But I'll stop my rambling there and invite Arundati.
Thanks, Dilip. And thanks, Yashna and Akshay. This is great to be a part of this webinar, and hello, everyone. So at MHAi, we started as a network or as a collective, bringing together organizations working on menstrual health and hygiene with a goal to kind of influence policy. And one of the key things that we identified early on as a way to influence policy decision-making was that how do we draw upon our collective strengths, and how do we draw upon the evidence that our individual organizations were sitting on, and how do we bring that to bear to present to policymakers as a collective. So evidence for us was a very core starting point and continues to be a very critical pillar of our work at MHAi. The way we're looking at evidence, or the way that we have unpacked evidence, has evolved over the years, and I hope will continue to shape our work and change along the way. But as Dilip said, I think for us, a driving factor of why we hold evidence so dear is that it gives us direction. And I'm using the term evidence quite broadly. I don't mean quantitative research. I'm not just meeting rigorously done qualitative research, but we have also expanded the way that we look at evidence. So I'll talk a little bit about that. But we feel that evidence gives us direction. It gives us directions, as Dilip said, for our program implementation. It gives us direction for our asks to donors and other investors. It gives us direction for the kinds of recommendations we want to propose to government at a district level, state level, at a national level. And I think that direction is very critical, and how we can inform that direction with different kinds of evidence that we have increasingly available to us is key. I want to give you two examples of how I feel that evidence has really shaped the menstrual movement. In 2011, there was a data point that came out that 12% of Indian women and girls are using sanitary pads. And that was a start of the free distribution program that was championed by government, championed by NGOs and individuals. And it continued. It set the scene for, my God, we need to shake this number. And it took us a long time to stop media from using that number, to stop academic research reports and organizational reports from using that number, because it was such a compelling number, and it set a course of action in motion. And yeah, so just that was one example. The other really compelling example from the menstrual health space that again shaped the way that much of Indian programming has happened is a data point, and Dilip, you would remember this, that X% of girls, or a quarter of all girls, drop out of schools because of their periods. And this came out 2013 maybe, and like, we need to invest in that, less focus on schools. And again, and Dilip, you know this, it's like how difficult it is for us to say menstrual health is beyond adolescence. They are very critical, and we need to get them young, but it's also about adult women and others who menstruate for those next 30 years. And we still haven't been able to shift that narrative. So, data and research and the way it is used and communicated is so compelling that these two examples show that it really sets the course of action, not just for government, but also for other sector stakeholders.
Sorry, Arundati, I think we got
yeah.
lost you in bits. So just want to repeat the first indicator you said. I think
Oh,
initially
I'm so
we got
sorry.
that, but the rest I suppose we got. The first the
Yeah, there was this
example. Yeah.
percent of Indian women are using sanitary pads.
No, I think we're losing you
So
again.
Oh, you can't hear me? Hello?
Can hear you now. I think.
Okay. Is this okay now, Yashna?
Yes.
Okay.
Yes.
I think
I'll check you sooner. If it
yeah.
gets cut again. Yeah.
Yeah, thanks, Yashna. I'm sorry about that. The first data point was that 12% of Indian girls and women use sanitary pads, and that 88% were using unhygienic materials and rags.
Yeah.
So that's one thing. The other thing, so I'm trained in qualitative research, and I love also quantitative data, but I'm trained in qualitative research, so I do value it a lot. I think I tend to look at evidence as a puzzle. It's every piece of evidence gives us a piece of the puzzle, and that entire puzzle cannot be completed if we don't have qualitative data. And also, I have over the years expanded my own understanding of evidence to also include field voices. So when I have spoken to Dilip, his team, and so many other NGOs, individual activists, individual trainers who are doing fantastic work, there is a different lens that they bring. There is an understanding of how a program should be rolled out. How do you engage with young people? How do you engage with an ASHA worker? What are those tricks, those tips, those strategies, which you don't hear about? And for me, that's also a part of the evidence package. It's pieces of the puzzle that we need to start putting together. One example. Sorry. Before I come to the example, I think that we're sitting on a lot of large data sets now. We've got good data. NFHS gives us data, and other such large data sets, but they don't help us answer the why and the how, and the what else is happening, as Dilip said. What else is happening in that girl's life that's making her behave in a particular way, that's getting her to make these choices. And I think that's where the qualitative research insights play a really, really important role. So going back to the example of, X percentage of girls drop out from schools, and it was horrific. And, we thought that the solution, because of this other statistic on sanitary pad use, was that girls don't have sanitary pads. So we need to give them pads, and there are no toilets in schools. So we need to put toilets. And, but when we speak to girls on the ground, when we speak with people who are deeply engaged with programs, they'll tell you that, actually menstrual pain is an issue. And when you dig deeper, they'll say, actually the girls who report menstrual pain are also those who are anemic. And then you begin to see this other picture emerging, which is not reported in research studies. It's not there in media articles. It's not there in research reports. So, and you're like, okay, so there is a lot more going on here. And when we're looking at solutions from a programmatic level, from a policy angle, but also giving us direction for future research, we need to start exploring these other connections. And that's, I think, where qualitative research can really come in. Yeah, I'll stop here.
Yeah. Super. Thank you so much, both of you, for sharing that. For me as well, this topic has been quite close, because one of the initial researchers that I was a part of was also on this, and in schools, it was a combination of education and menstrual health. And that was the case. The reports were saying something completely different when and it was on distribution of pads. And when we actually asked people, it was like, hey, distribution is there, but they're using to stuff pillowcases. There's no use as such. So, that has been the case. And that's actually because of the sensitivity of the topic. It's a lot more nuanced than just numbers. And I think for us to know that qualitative data has way more value, because it's such a sensitive topic, than just, maybe there are some things where quant can really do enough. But I guess these are one of the few areas where it's important to dig deeper, and it can be a combination, as you said, Arundati. It's like you need to look at it together. Just to also follow up on Dilip, what you shared was, in the work that you've done, and also with communities. So can you share some examples where amplifying community voices led to some outcome in the work that you've been doing for the last few years, and maybe not just qualitative data, but also where mixed data was included, and how that shaped in your program. And you shared that it's a part of the way you function now. So how does that really pan out is something that we'd love to know.
Yeah, absolutely, absolutely. I will build on something Arundati was sharing. So until pandemic happened, a lot of our outcomes as a menstrual health and hygiene organization was revolving around these standard, most celebrated indicators in the ecosystem around improved hygiene, improved school participation, improved attendance, all of that, right? And the pandemic happened, and our work had to shut down, and then we, within the first 2 months of the pandemic, responded to the pandemic with a helpline, which is India's only helpline around menstrual health and hygiene. And through the 2.5, 3 years of the pandemic, we received about nearly 200,000 plus engagements on the helpline, right? And nearly like 50,000 proper calls with different menstrual health conditions. And one would assume that as soon as you call it a menstrual health helpline, people are calling into the helpline to ask about sanitary pads, to talk about toilets, to talk about hygiene. But the top three concerns that we really received the calls on was, one, pain management around menstrual health, irregular periods around menstrual health, and third was more around the infrastructure components, etc., right? Like, but the third one was disproportionately smaller than the top two reasons that people were calling in with. And I think that was a huge inflection point for us as an organization, that we have been working in this area for 8 years now, and we thought there is a certain problem that we are kind of like trying to solve, but seems like the real problem on the ground is entirely different, and what people are calling in for is very different, right? And that has had a big pivot in terms of what we look at work, what our theory of change is. From a hygiene-driven, school-driven organization, we have moved to now wanting to build evidence around how menstrual health can drive health outcomes. That is, how, like, even within the helpline, we have realized that 1 in 4 girls experience menstrual irregularities that lead to extreme discomfort and also disrupts a whole lot of their lifestyle. So how can we help girls identify menstrual irregularities and seek timely healthcare, so that we're able to like help them stay in school and also participate in life better, has become a theory of change now, right? So that's one just example of about how organizationally we have kind of taken a 180 on what we believe in, what our theory of change is, based on the data that has really come from the ground in itself, right? So, and a couple of other examples is particularly to do with engaging men and boys, right? Like, we started engaging men and boys back in 2018, and the first thing that we did was go to men and boys and talk about menstrual hygiene and various different products. And soon we realized that, like, men are going and there is improved hygiene practices being indicated in quantitative data, but when you actually dig in, it's the men who are deciding what products their women in the family should be using when it comes to thing. They was pushing out a lot more menstrual cups because it was cost effective, right? So and then we realized that, okay, like, this is not working, and then we started working with men around their own sexual reproductive health concerns, and as part of the helpline, men could call in to seek help with their own sexual reproductive health. And that became a whole new Pandora's box of, like, we receiving thousands of calls from men on their own sexual reproductive health concerns, like premature ejaculation or infertility, etc., which we were totally oblivious to until then. Like, until then, we were mostly going to them, trying to solve for problems that women and girls are experiencing in the communities and seeking their help in the intervention. But suddenly we realized that, oh, there's a whole sexual reproductive health crisis with men themselves that we are not even talking about, or they are not even talking about to anyone else, right? So that truly came only from qualitative understanding of going to men and understanding, like, what can we really do about solving these problems, right? So and one last example is, while we're driving the health outcomes, we acknowledge that a whole lot of these other services are critical for us to be able to improve menstrual health, like access to products, access to toilets, access to water, etc. While we don't directly address these concerns, what we do is we do audits of schools that we work with in governments, where we collect data around how many schools have access to toilets and water and door latches and safe toilets and all of that. Earlier, what we used to do is we had our enumerators go to these schools, collect this data, and directly present it to district administration, etc., etc. But then almost a year and a half ago, we were like, why do we have people from the outside collecting this data? What does it mean for adolescents themselves to start paying attention to what are their needs with respect to infrastructure within school premises, and how are they able to identify that and report that? And now we have adolescents themselves. We're trying out a bunch of things to figure out what is the best way to go about it, on using WhatsApp groups, QR codes, to understand how can adolescents report the lack of infrastructure facilities directly instead of we having to go and collect the data from them, etc. That was one step. But two, as we were like, okay, that helps. But like over the last 6 months ago, what we realized was they're reporting the data that helps within the school premises, but we see that within their neighborhoods, there are other schools with similar issues that these adolescents are totally not aware of. So now, as part of our education sessions, we use the data and take it back to our education sessions to say that it's not just your school, but there are 20 other schools in your neighborhood which don't have access to products. And we realized that that has led to a whole lot of increase in adolescents writing letters to district administrators, requesting them to look into these efforts, etc. Right? So I do think there is a sense of empowerment in just being able to bring collective data to an individual and say it's just not you, but there are many others who are experiencing this. That makes them feel like it's not just them who's experiencing the problem. There's a sense of accompaniment that comes with others facing similar issues. But yeah, those are a few examples coming to my mind.
Yeah, okay.
Hey, sorry, I'm just spotlighted myself. Spotlit. So Dilip, just curious about this because I think very often, these sorts of efforts are so difficult, right? Like, I think even people trained in data don't necessarily have the skills always to be able to communicate that to more educated quote unquote audiences. So like you taking the data back to classrooms is wild as an idea. How are you telling those stories? How is that being communicated? Like, is it just sort of telling this broad story, or is it really getting into some of the nitty-gritties? Just curious if you can double click on that a little bit.
Yeah, I think we are learning along the way. I don't think we have nailed it yet. And there, once because these we call them wash audits. And by the end of last year, we realized that we have audit data of almost like 600 schools from one district alone. And I'm just like, what are we doing with this data other than just like chapifying them in a report and putting it on a desk, which we are not even sure anyone's properly looking at and actually doing anything about it. And one immediate thought that came was with this thought process of what does it mean to take this data back to adolescents within schools. And I do think two parts to it. One is with adolescents themselves, we are trying to figure out what is the language that we need to use and how can we best present this to adolescents where it matters to them, instead of this just becoming an overwhelming point of data that they're finding it difficult to digest or process, right? So I think just like right now at this point of time, there's a fourth session where we do a infrastructure walk in every new school that we do, where adolescents walk around the school to identify what are the gaps in the wash infrastructure in the school, right? As part of that walk is where we have started integrating this data, where we say that, okay, you're observing this within your school, but it's not just your school that is experiencing this, but there are so many X number of schools in your block or district. So then they're able to like resonate and understand what this exactly means for rest of the schools. But I think there are better visual probably ways of doing this or engaging interactive ways of doing this, but I think it's an area that we're still exploring. And the other two things is we're also trying to lean into, okay, once they have access to this data, what does it mean to support them in being able to seek what they need to seek from the administration and system to be able to do that? It's like once they have data, like they know that 50 schools in the district don't have toilets, so what, right? Like, so probably the simplest way is like write a letter, but what else can they be doing that really makes their voices heard or their stories told? And one thing that we're kind of currently exploring is What does it mean to arrange probably like or coordinate visits between the schools and the district administration for them to be able to like voice out the data, hand over the letters in person, have that conversation and see what it means to them. But these also feel like solutions that can be implemented at a micro scale, but at a macro scale, it still seems like this data needs to be better seen at a decision-making structure for them to be able to respond. And one thing, today morning we were having this conversation incidentally. We also realized that yes, these letters are going in through the year, but most of these district administrators and state action plans happen in October, November. So what does it mean to really have this data reach the decision-making structures and desks around that time, so that it actually feels like there's a certain time that there is immediate action that could be possibly responded to. So yeah, like there is a lot of just thinking happening at this point of time around the timing, around the means of engagement, etc. But my takeaway so far is the most simplistic thing is to tell it in the words and languages that the adolescents can understand immediately instead of complicating it.
Yeah, I think a lot of times we often come to this point that do you represent it more, look how fascinating this data looks like, and this is what it speaks, or it's just in plain words that there are 40 more schools who don't know what is happening, and that's about it, and that is going to do the trick. And we're often on that, I mean, we find ourselves on that crossroads quite often, which is that and who are the stakeholders. I think it matters to who is the person and what is the way of learning from data and kind of data and representation. I think that's I mean, completely understand what you're sharing. But yeah, Arundhati.
Sorry, I should finish off and then I want to actually come in.
Go on. Why don't you come?
So I think, Dilip raised a great point, and Akshay had a fantastic question, and it took me back, I think 20 years to when, when we started using, or, we were
lost you again.
You're right, Yashna?
Yes, can you hear us?
Yeah, just 1 second. Let me just check.
We can hear you very well now.
Okay. So one is, this concept of we take data from communities that we work with, but what are we giving back to them, and are we engaging them in that process? And I started my career in HIV, and I used to work with sex workers. And one thing we realized is so much of data being collected. This was 2002, 2003. It was a hot topic. And we were like, there's something that we're missing. So we tried something called participatory ethnographic research, where we worked with women in sex work themselves, and we made them researchers. And we said they were illiterate. So we co-developed actually questions and guides using pictures that the women themselves drew. Like, who all do you have sex with? What do you use when you have sex with these kinds of people? And where do you experience abuse? Where do you experience violence? All of that in picture form that they themselves drew. So it wasn't some fantastic artwork. And then these women went back to their communities, which were very diverse, living in different kinds of brothels. And they came back with insights that despite spending a couple of years in the field, every day, going to brothels, speaking to these girls and women, we just didn't have. Wow. And then we were like, okay, we have all these insights now. Again, very extractive, right? We're taking it. What do we do with this? So we were like, okay, you were the researcher. Let's see if we can do a community meeting. And you actually feedback and you get that validation. But, we had that time, that freedom, and no constraints to be able to do that, because this was a long process, right? I mean, every time we had one of our peer researchers go into her own brothel or her neighboring brothel to collect this information, she couldn't write it down. So it was like, you come back the next day. And at that time, mobile phones were very expensive. Okay, so we couldn't even call and do all of this. So come back the next day, whatever you remember, we're furiously scribbling it down. But at the same time, I mean, so this took time. We didn't do it in a month or 2 months. It took us time. but we actually spent that time kind of putting it back out into the community with these peer researchers sharing it. There were fights, there were arguments, there was pushback. But what we ended up with is our kind of very mainstream condom distribution, STI testing program was not working because these women had their clients with whom they were using condoms and being safe, but they had these other men who were what they considered husbands, who were very different from clients, who they were having unprotected sex with, but who had multiple partners and from whom they were actually at risk for HIV and STIs. And that made us kind of change course with our program. We introduced the female condom for the very first time as a pleasure tool with your intimate partners, very different from what you would do from a paying client, and got us to really rethink the way we were doing this programming. So finding that space to listen to communities, engaging with them in the research, and getting them to, to share back those insights with their communities to figure out solutions is fantastic. Unfortunately, I'm not sure our current kind of landscape of funding and the pressure to deliver programs in 12 months, this doesn't allow for that. But it's certainly, I think, worth for us to think, how do we bring some of that back? We as researchers, yes, we extract stuff, but we have a responsibility to feed back to our communities as well. So I just wanted to share that.
Yeah, I have a question, but I think Akshay also. Akshay,
I'm using this spotlight as a way of raising my hand. Actually, both of you, in different ways through your responses, the one thing that's interesting for me, and just looking at some of the things the folks who registered were kind of putting as queries or things they're interested in, what y'all are also getting at is the fact that if you look at only specific indicators, which are usually sort of these delivery indicators, output indicator kind of things, it's very easy to get caught up in programs that are around those indicators, right? That becomes the tail that wags the dog. And I guess that's what Arundati is saying, that so much of our programming now is around that we feel like we know everything we need to know, and these are the programs, how are you going to deliver it? Whereas I think your sort of extensive experience, continued experience shows that unless you're really digging deep and unpacking all the connected dots around this experience of being an adolescent, right? It's not just that aspect of, a menstruating person's experience, but all of those things, whether you're a young man, or all sorts of connected issues. If you're not looking into that, you're going to kind of miss the point when you look at outcomes. So you might hit the output kind of things, but you'll miss out on the outcomes. And that's where, like, I'm hearing that engaging with what people are actually saying and a wider range of stakeholders are actually saying kind of is the key. And these are such beautiful examples of how that's kind of come out. But I'll just an observation that I'm kind of seeing that connect for the between what you're saying.
Yeah. And I honestly want to double click on, Arundati, what you shared in terms of how these programs are structured these days, which are short term, which are versus how it was earlier. You had the time to even experiment with the kind of data you want to pull, with who are the people who are getting data. And I think it's a beautiful example of involving the people and the communities themselves to seek data as well as to seek solutions, because and this is a classic example that somebody comes in, does research, does proper ethnographic participatory research or whatever, in-depth research, and you still are give some suggestions, but who are the people running it, or who are the people who are actually implementing? Can we include those voices and such? But I honestly want to know, in terms of the state of programs these days, are we seeing any shifts beyond that? Hey, it's 12 months are not going to be enough for running something like this, or we need to make sure there is continuous data for us to improve, or continuous experiments to seek data. is that a trend that's coming in, or any change coming in? What can actually change to make it happen? And this is an open question for both of you to answer, essentially.
Well, I think Dilip would be better placed, but I'll come in quickly. The great advantage of being in a position that I get to speak to a lot of people engaged in programs and hear from their rather difficult experiences. I think, Yashna, the funding landscape has changed tremendously in the past, 10 years with the advent of CSR. And CSR is, it can be significant pools of money, but they also expect very, tangible, I can't say outcomes, but they expect tangible outputs, and within a very short period of time, right? But for any NGO, and I've only worked for NGOs most of my life, so we need the money. We need to pay our teams, and it is something that you do alongside wanting to do something more in depth with the communities that we work with. But CSR money often tends to be, and also some other non-CSR donors. It's outcome driven, it's infrastructure driven, and that's going to remain, especially with changes in our regulatory environment. We cannot deny that because it is a significant pot of money. And I think we need to figure out how to find the balance. We have always had institutional donors, right? Institutional donors have traditionally been multi-year, fairly large pots of money, want to do more in-depth work, exploratory, bring about more meaningful change, long-term change, changes in mindsets, social norms, etc. So we do know that pool of donors exists, but we also, many of our smaller NGOs working on SRHR and MH, we do not have that capacity to do that kind of work. We can build the toilets, we can give the pads, we can do our awareness sessions, we can run a campaign, yes. But, figuring out how behavior change happens and implementing an intervention that allows us to bring that about and be able to measure it and demonstrate what progress we've made, that is really tough for a lot of us. It's organizations like Uninhibited who have cracked that, but that has been after years of, I think, just learning, listening, doing, questioning, etc. Yeah. So it is hard. So, and I think institutional donors are very demanding. Again, I think it's something that Dilip can shed much more light on. And so we're in a weird situation right now, right? We need those, we need the funds that keep our organizations alive, keep our teams going, but limit our kind of work, while we're also trying to build our capacities to apply for these multi-year meaningful change wala grants, it's not easy. Yeah, over to you, Dilip.
Similar thoughts. I feel the rush is very real. I do think there is a certain, I think we as an ecosystem have moved from non-profit to social enterprise to a corporatized non-profit model right now, where we are seeing new age, almost corporate looking non-profits today, where there is always scarcity of time people within organizations. That I do agree that there is a sense of normalization to run non-profits like a factory-based model. Like, we have built this formula, let's just replicate this formula a zillion times to a zillion people, and that's what work happens, right? And while I do feel like I had bought into that philosophy a couple of years ago, and I think I was on the edge of doing the same thing. But I also feel there is value in it, but for spaces where the ecosystems are evolving, the problem statements are evolving. There is lack of understanding of the on-ground realities in itself. I feel that's a potential risk, and I do feel menstrual health, quite a few sexual reproductive health concerns are in the same area, where we don't know the realities of what is happening today, right? And the twofold there, I feel like and expecting a very early stage organization with very little resources or small team members to spend so much time on the ground and build solutions in such a rigorous manner is difficult, and it's mostly quite unrealistic, right? But what I've also observed and seen is organizations who end up doing that, or who end up spending the first few years actually. I'm sorry, my neighbor dogs are out for a walk.
We can't hear them much.
Okay.
I think only when you turn, you're like, okay, it's quite loud for you.
Okay. So the organizations who end up spending that time really understanding on-ground realities and building a model that really integrates a whole lot of like these systemic concerns and concerns, where they're not just looking at a solution as an individual expectation that we're expecting one individual to do these 5 things, but are able to understand that it's a systemic concern, have managed to like really grow exponentially after those 3, 4, 5 years of really doing on ground work solidly. So I do see a benefit of doing that, and I've become a big advocate of saying that spend a lot of time listening to stories on the ground and actually building a solution that kind of like incorporates a whole lot of these realities. Having said that, I feel the responsibility is on the big influencers and the donors and the big organizations who have now gotten to a place where they have access to these resources, that what role are they playing in really telling these stories and bringing this nuance, and how are we really mobilizing these stakeholders to be able to adopt these ways of doing things, is a question that I'm also currently sitting in with, that I feel putting the burden on really small scale organizations also is not a fair thing to do.
Yeah, fair. I think this is a segue into the other part about making this data, basically advocating for including these voices, including data from the ground, not just say within the country, but also at a global level, and also especially to you, Arundati, because of the work that you've been doing. How do you think that can be presented for people to start? I understand that it hasn't shifted, the mindset hasn't shifted, but what can be done, or how do you think that can be done at a global level, at an Indian, like pan-India level, for it to be at least start seeing, or like what is the effort that is already happening from your end or from MHAi and such?
Darshana, I think it is hard. I think amplifying grassroots voices at higher levels, whether it's a national level, whether it's a global level, is very hard. But we really do have to find ways to do it, because much of global advocacy is running on the fuel of what happens in countries. It's what's happening by NGOs and their implementation efforts. It's what local researchers are learning. It is what local activists are doing, and then we are reaping the benefits at a global level, drawing upon all of this. But we're not creating spaces for, what do you want to call the global majority, global South stakeholders to be at those tables. It is a hard. It's hard to navigate these spaces. I think, as again, both of us have seen, I've been trying to do for the past few years, but we have to do it. So a few things that I think we've tried, and we're trying. I can't say that they're entirely successful, but where I think that we're trying is, one is, if any of us from the global majority or global South have a seat at these global platforms, let's leverage it, and let's figure out how we can bring more voices from the global South to those tables. So how can we play that catalytic role? So I think that's one. One is that when any of us have a seat at that table, how can we be more proactive and reach out to networks, to individuals, to organizations who we're not familiar with? So how do we expand our thing so that our understanding of issues goes beyond our immediate connections that we may have in the global South? So I think just pushing ourselves out of our comfort zone and reaching out more and more, because then that helps us to bring that. First of all, see those diverse voices out there, spend time listening to them, and then figuring out, okay, how do we get them to the table? I think we also need to identify who are those global North allies who are open to this. So, for example, you've got INGOs that have country offices. So, how do we get them to say that, hey, instead of you, can you tell me who from your country office can be on this panel or can write this report or do this with us or come to this conference, for example, so how do we create that? Plus, I think showcase where global organizations have done that well, not in a tokenistic manner, but really genuinely done that, and kind of showcase them as this is a model that has been tried. It's a model that has worked well, and maybe you can try it too. I think there is a certain amount of support that Global South stakeholders need to tell their story. We often hold back, we're shy, we're not very comfortable in these spaces. They can be overwhelming. It's certainly been that way for me. But then how can we find support in each other or support in others who can help us come out of our shells and tell these stories? Because we're simply not little tokens from the global south. We have something to say, we have expertise, we have ideas, we have thoughts, we know what needs to be done. But how can we express that? And we just have to start, however small, but we need to start making some of those efforts. So I think these are some of the things that we're trying. Again, as I said, don't know how successful, but we need to keep at it now more than ever. Yeah.
Yeah. I think, Dilip, to you also, you've been part of global coalitions and at platforms and spaces. How do you think, speaking also from the point of view of evidence, how do you think that can change, or what can be done more, or what has already been done? How has Uninhibited also been successful in some ways? It'd be nice to hear a little about that.
Yeah, I think I'll build on what Arundati was sharing as well. I feel one thing that really comes to my mind is just like how I was sharing earlier on how it helps for a girl to know it's not just her school that doesn't have a toilet, but it's 20 other schools in the neighborhood. I feel a similar thing applies for international advocacy as well. I feel we need to listen to each other's stories and build on each other's stories for those stories to be heard on a global platform. And like things like these, like if period pain is such a huge factor, and if menstrual irregularities is such a huge factor, and like what does it mean to be able to like for the stories from East Africa to India to Latin America to come together and be able to build that narrative in terms of a joint storytelling? I feel there needs to be a more collective storytelling effort for the voices to be heard. And what does it mean in today's world? I think probably today it's far more easier than ever to be able to capture those stories from multiple spaces around the world and tell that story together. So I feel there is opportunity and power in being able to tell that story, a collective story. That's one. Second is one thing I try, and I often like burn my fingers in the process, is trying to understand what does it mean to meet these stakeholders where they are. And I feel like most of these like UN bodies or funders in the West have certain agendas built, but what does it mean to meet with their agenda and build that relationship for us to be able to get that seat at the table, for them to be able to listen to the stories on the ground, for them to be able to then broaden their perspective itself. So like I do feel there is value in being able to, like, instead of saying that like we're global south or global north, we have a different story to tell, etc. Like what does it mean to meet where they are, and what does it mean to take these stories where they are and build from there, is something that I often think about. But like spaces where I've burned my fingers are like we trying to push for increase school attendance of adolescent and girls with menstrual health interventions, because that's where the money was, and that's where the donors from the US were willing to fund us. And we were like, okay, we're going to lock in those and move forward. But then we realized that like with what we're doing, we will not be able to prove that there is improved school attendance through menstrual health intervention. So I feel it takes a little bit of like a tango for us to be able to figure this out.
Yeah. I think it's also one of those problems you may not ever get the right answer, but those are experiments you still have to run because it's worth the it's worth the effort, and it'd be hard to not do it and be like, oh, we didn't try, and because we just didn't want to burn our fingers. Fair enough. Just maybe probably a few other points that we wanted to cover before we start the Q&A, and others who have any questions, please leave it in comments. But few things before we wrap up, just in terms of, we're talking about data sharing, we're talking about making it available, we're talking about stories from the ground to be heard from different parts, right? And meeting at a common point. But while we are menstrual health, sexual reproductive health, they are sensitive topics, and the idea is to understand what are the risks that we see when we are sharing this data. How do you share this data ethically? Do we have any practices, in our country or outside, which has been something that, yes, this informs that data ethic. And Arundati, I'll start off with you because of the work as well as the thought that I know you put in, and then Dilip.
Oh, I love the question on ethics. I think research ethics is really broad, so I won't get into the ethics involved in conducting research and writing up the papers and how journals play, a gatekeeper role in ensuring ethical reporting. But I actually want to step back and say that, when we have insights and evidence in the public domain that are used by advocates like us, or those in, doing the kind of ecosystem work that we do, there are a few things that I think that have struck me over the years. One is that there's ethical reporting and ethical quoting of data points. I think that as folks who are often collating, data and insights, research, etc., we often there's a tendency to quote that has been quoted in one paper that was quoted from another paper, but we don't know where the real source is, and that gets lost. And it's quite amazing how this has happened in the space of SRHR and even menstrual health. So, for example, a recent one that emerged for me this week is someone messaged me saying, where's the actual source that sanitary pads contain 90% plastic? And I was like, I don't know. And I was ashamed. I was like, I don't know what that original research was. And so I was messaging frantically my work partner, and I was like, do you know this? And she's like, holy cow, I don't know, And we were like, this is terrible, because we are quoting from some article that quoted that, and we just lost that stream of where the original research was. And I think, again, this is how data research can take a life of its own. So I think that ethical reporting, let's find a reliable source. And by reliable source, I don't mean a high impact factor journal. Let's find the report, let's find the NGO that put it out, let's find the researcher who put it out, but let's find an original source and try and quote that. The second is, how are we using the evidence that we have ethically? What is the end? What are we using it for? Whose agenda are we serving? Are we doing it to sensationalize an issue? Are we doing it to draw attention to an issue? And I think that's also a really important one. So, for example, I think, when was it? Maybe about a year and a half ago, Toxics Link came out with this report on chemicals in sanitary pads, right? So again, it was hugely sensational. There were media reporting on it. It ran a bunch of people into panic. Social enterprises were like, oh my God, what are we doing? But again, when we dug into that report and data, we found that, yes, there are chemical pads that are present, the chemicals that are present in sanitary pads, but they're within so-called permissible limits that are set at a global and at an India level. But the way that data was used and framed is it sent users, people like us, into a frenzy of what are we putting in our bodies. It sent the industry into a bit of a frenzy, but it was being done with a particular goal in mind. And when we then are using those data, how are we doing? So I think that's another one. I think for me also, I want to go back to my point that evidence around these issues is like a like trying to make, to complete the puzzle. And there is ethics in completing that puzzle. We can either go with the limited data points we have that feed into a particular narrative, as Dilip had pointed out, that, we want to know that for access to menstrual pads leads girls to drop out of schools. Yes, we can go with that. But if we really want to be responsible towards the communities that we are working with, then it is our ethical responsibility to say that while we may not be able to do the research, what's the evidence out there that paints that wider picture, that gives us that more comprehensive overview. So I think that just stepping back, I think when I look at ethics now, I'm trying to look at it from these lenses. I'll stop here.
Yeah.
Like, can I just maybe, sorry, let me add the spotlight.
You haven't spotlit yourself.
No, I just started talking. I think the corollary to what you said at the end, Arundati, is also then to be extremely transparent about what our gaps in knowledge are, right? And or where, certain claims that are being made based on evidence or research might have some limitations. So, really kind of making the science of it very, very apparent, and the fact that it's all work in progress, learning in progress, and that becomes an important part as well, because I think there's a lot of bad science, or science communication is quite poor, like you said, right? And we see that a lot with food related reporting, classic example, right? Chocolate is good one day, it's bad the other, that sort of thing. So I think, I guess that's a important corollary for us to call out the gaps as well.
Yeah, for sure. Dilip, you want to add anything before we?
Just a couple of points that are coming to my mind are particularly, this is something that has happened to us, and quite a few moments where we had to force ourselves to take pauses, particularly when you run a interactive platform like a helpline. People are calling in with very sensitive concerns and questions that it almost feels like we're able to like see patterns and build insights, etc. But there's sometimes like we have to force ourselves that do we have consent to use all of the data that is coming in on these platforms, and what does it mean to have fully consented data, even when we go on the ground. Like we talk about a lot of observational data collection, like when we observe just like what is happening in a classroom and collect data. But like then most often we just write random names. Sometimes there are like names that we are not sure whether they're correct names or wrong names. So I feel there needs to be an increased effort on what is consented data, what is the data that is collected without consent. Second is second one is what I've seen a lot happen in the menstrual health space, is a misinterpretation of the data that is being collected also. That
I don't think it's only to do with this sector. It's across.
Like this whole sanitary pads piece also, like what I think Dati was talking about in the beginning of the call as well. And I think there are larger narrative concerns also, like there's this whole narrative around how culture is contributing to menstrual health being a problem, or and just like how can you really like and this is a conversation that I've had when I've been traveling in the West, that is this to do with your culture that it encourages a whole lot of this, like. So I feel this interpretation is something that we often don't talk about enough, and surveillance is definitely the third one, which is major concern within menstrual health, with menstrual cycle tracking apps and a whole lot of that. I feel like how much of surveillance is happening and who's keeping track of this and how is it contributing is an issue that keeps popping up here and there, but
it also gets covered very easy. Like it's just like, hey, there's like this is a problem, and then it's not a problem anymore, and still continues to be the like it just, people just accept it. I feel like it's just people are being like, hey, things are getting tracked, so what do we do, kind of a thing. But absolutely. For sure. I think these are always I feel these come in spurts, but there needs to be a place, and I feel like I'm adding my lens. There needs to be a place where at least some of this stays for it to be not just data points and for it to translate into what are we doing to protect um, identities, what are we doing to protect and ensure that we follow some ethics. And there are many mandates. Like always, it's often that policies are there, mandates are there, but what do we do with it? How do you make sure that it's getting implemented is something which is very, very critical, and more so for this sector, for sure. Just before we wrap up this thing, just want to, and Dilip, also continuing from what you shared around data to action and how you've been, like, especially at Uninhibited, how you've been doing some of those and changing routes, right? Changing complete directions of your organization. What do you think are some like our tips for organizations, to say that you can overcome those barriers and really like what are the critical barriers and how do you overcome for ensuring that data translates into action and doesn't sit like just in a report or just somebody has submitted something or just like, hey, we collected 100 stories or 2000 or 2 lakh stories and it just stayed as like an input which we don't know what to do about. Like any suggestions for organizations and then Arundhati, for you, any suggestions across the sector for different stakeholders of how do you really include data into action?
One probably oversimplified answer is qualitative data, but also like I think there is an added benefit with qualitative data when you're part of the data collection process. I think just listening to those stories and listening to the being part of that participatory research yourself, I think pushes you to really think about like what does the story mean to you and what does the story mean to why you're doing what you're doing. I feel data also kind of pathologizes a whole lot of what the problem is or what needs to be done. I feel qualitative narratives and data collection processes have a beautiful process of bringing you to the ground and really seeing what is happening. So I feel that's one way of really pushing yourself to respond and interact with what is on the ground. And the second, I think, is really asking ourselves like what are we doing this for? Like, are we doing this for the funds or are we doing this for the governments? I think just going back and revisiting why are we doing what we're doing, I think really pushes us to like put the stakeholders at the center of the conversation and see what more needs to be done. But I'm pretty sure there's more, but they're not popping in my head right now.
Super. Thanks for sharing that. Arundhati, I see a few hands. We'll just go with your response and then get into questions, and Geeta will take you right after that.
I think this is a really tough question about the questions that you've answered. I have one. I think we need to figure out how we can make time. I think we need to figure out how we can build and support capacities to be able to do this, to be able to generate evidence, to be able to look at it not just as a donor requirement, but something that really helps us understand what's happening in the spaces and communities where we work. I think we need to support ourselves in saying that how do different kinds of evidence kind of come together to make that story, and how do we then present that story? Yeah, I think, but we all need help in doing that. I think we also need to make evidence more easily accessible to people. In India, we're sitting on a wealth of data and insights and evidence on menstrual health, on SRHR, but not everyone has access to it. How do we do it? How do we make it easy for them to draw those key messages? And we've tried to do this at MHAi. I've not done it very well, but it's something that I think we really do need to do. But yes, those are my short answers. It's a tough one, but we have to do it.
All right. Thank you for sharing that. There's a question in chat. I'll go with that first as that came in first, and Geeta will then open it up to you. In your experience, how challenging has it been to approach schools for SRH education advocacy? And are school authorities generally receptive to this? Dilip, do you want to?
I think we've experienced this on polar ends. There have been spaces where they have not been receptive at all, and whereas we have seen good momentum in regions where the district administration or the states are under pressure to show progress on that specific indicator, like a teenage pregnancy or many other sexual reproductive health indicators. So, for example, Palghar in Maharashtra is one of the regions that we work with, where we didn't even have to like bring it up, but the district administration, in fact, requested us that we should integrate sexual reproductive health as part of the menstrual health work that we do. So, so I do think there are spaces where the governments are looking for help around these areas, and I think it's a matter of identifying those regions. But in other regions, there is a need for us to package it in a way that where we say that it's not sexual reproductive health, it's menstrual health, and then we don't include it as part of a curriculum. But if questions come up, then we respond to those questions and say that we didn't say anything. We mostly responded to the questions that came into the classroom. So, yeah, it is very contextual from region to region. Arundati?
Yeah, just following up on what Dilip said, I think where it's we're dealing with more conservative, more traditional government officials, we have to package it differently. But where there is openness to talking about SRHR, especially amongst young people, we have to also be very careful. And I think sometimes NGOs need to be the gatekeepers. We see that there are registers that are being maintained of when girls have their period. As you know, in ashram shalas, I think that there is even a when girls leave school and when they come back, they have to undertake pregnancy tests so that are they pregnant or not. You know, it's quite intrusive, some of this, and I think that we do have to, when we're looking at SRHR, it's to empower young people with the knowledge so that they have control and understanding of their own bodies themselves, not for somebody else to control and name and shame them. And so it's a tricky scenario that we have to navigate.
I think that's a classic example of need for qualitative narratives. Like we in Palghar, this happens a lot in ashram shalas, where the students go off for chutti, and when they come back, they're taking pregnancy. And month on month, the headmistress checks the undergarments of the students to check if they got their periods or not, right? So in the quantitative data, it might seem like it's all okay, but
Yeah,
these narratives that often don't come out.
yeah. Geeta, do you want to go?
Yeah, hi everyone. I don't have a specific question, but I kind of wanted to discuss that, as Dilip mentioned once, that while doing these kind of lot of menstrual hygiene interventions that you carry out at times, specifically to kind of improve the attendance, specifically for the girls, adolescent girls. You mentioned that most of them don't work. So is there anything that you know of has done a little better than some specific initiative? Because see, when these kind of evidence-based researches come out, in any of the newspapers, news medias anyway, organizations like ours and us will just immediately start thinking about what kind of incentives will work to tackle this particular, problem that exists. So how do we so for an example, if, just distribute, so from my experience, even I've noticed that just distributing the pads will not work towards decreasing the attendance, or sorry, increasing the attendance or dropouts of the girls. So why not add an additional angle to it by, say, aspirational, rewards to the girls along with the hygiene kits? So something innovative, will that work, or has there any evidence that any kind of incentives has worked a little better than the other, or we just have to give up? I don't know.
Yeah, that's a great question, and we've spent years thinking and talking about this, including Arundati and I. I feel Yeah, I wouldn't make an extreme statement of saying that it will definitely not work at all. Probably in a context it might work. But from our experience, what we have learned is, at least in today's age, girls are missing out of school because of their periods for a day or a day and a half, maximum two, right? And that is the impact on attendance at this point of time. In probably like most generic spaces, probably there are other extreme places as well. If you implement a menstrual health intervention and if you want to see progress, probably you'll see an improved attendance of that one day. But there are so many other factors that are contributing to a girl's school participation, like caregiving, migration, household responsibilities, that they're missing out weeks and weeks of school because of that. That you making a case that you're improving and increase school attendance by one day by doing so much work is not necessarily justifying them not missing school because of other responsibilities, right? So probably the incentive could be, what is that one responsibility or one factor that is playing out in these adolescents' life that is a major contributor to school attendance? Are we able to package the menstrual health intervention with that to probably like make that case? But from our experience, each of them are like a world of their own. Like caregiving is a world of their own. Gender-based violence is a work of its own. That we've struggled to find that space, but also like after a point, we also were like, why are we trying so hard to just improve this one indicator while that's not what we are here to do for? What we are here is to like really like improve menstrual health for everyone, and whether that leads to improved school attendance or whether that leads to improved health or improved equity are all different possibilities, right? So yeah, that's what comes to my mind. Arundhati?
I completely echo what you're saying. I think we hear this all the time, that the attendance is due to so many other issues. As an NGO in Jharkhand, and again, it was just household responsibilities and the pressure for early marriage post-COVID that got them to drop out, because these girls were enrolling in schools, getting married, and so they were running their marital homes, and they simply did not have the bandwidth to then be in school as well, even if they had not become pregnant or even if they didn't have a child. And a menstrual health intervention, as this organization was doing, was not getting them to be in school, because the issue was not pads and pain and discomfort. It was the fact that they were running a household. So I think we need, in your areas, you need to figure out what is keeping them away from school, and is your intervention then designed? And then you can be as innovative as possible. But also going back to a point that Dilip, you had raised, right? That how do you zone out from that girl and just focusing on her to the various factors that are influencing her experience of menstrual health in school, with her teachers, with her parents, with her communities, and that. So is there a way that we can zoom out and see, where can we intervene? Because we cannot do everything, right? So where can we intervene that could have possibly a larger contribution towards improved menstrual?
Thank you.
Arundhati, you got cut off at the end there. Did you mean to mute yourself?
I think I muted myself.
Oh, okay. I'll just add one small thing, just building off of what Dilip and Arundhati said. Like over the last week, I've been in the field in Odisha and Jharkhand, working with people working on commons, right? Forest, water, things like that. And especially in Jharkhand, a lot of the conversation was around migration, and people talking about it from the point of view of livelihoods, non-timber forest produce. And I didn't think I would be making that connection in this conversation. But one of the whole work there is about them building multi-actor platforms to tackle larger issues. And in Jharkhand, the larger issue they're talking about is migration. And one of the NGOs was like, we don't have other organizations working on nature related solutions, but there's a really strong organization working on education. And our whole point was, that's perfect, because migration affects students so much, they miss classes. So if you're tackling migration as a group, you might work on livelihoods, but you also can get the help of schools and school students and teachers and that ecosystem to do this. And I suspect that zooming out of our silos, looking for, in that context, we've not even been calling them collaborators. We just said friends, looking for more friends in that block or that district you're working in can go a long way in, looking at how you solve these problems. So just a little, I genuinely wasn't expecting to make this connection, but it seems to.
Super. Just want to take a minute to check if there are more questions. Thank you so much, Geeta, for that. I hope it got answered to a certain extent. But anything anybody has, or else we could just close in time. All right, super. So I think thank you once again. Thank you for being, first of all, being such a wonderful audience and listening to us have this conversation. As we said, we'll be sharing all the recordings, and there's a link that was shared in chat. So make a note of that and share it with you all in a day or so. And thank you so much, Arundati and Dilip, for this time. We're really, really grateful to you for being a part of this. And we wish to have some more of these. But thank you once again. I think there was a lot of insights. I don't think we can do this in the next 2 minutes and synthesize, but we'll be happy to share more over over LinkedIn, over blogs or whatever. Like, we'll create some space for synthesizing all this information for everybody to read along with the recordings. All right, thank you once again. We'll be ending this call, but any last words before that, Dilip, Arundati? Just I just want to thank you. But
No, this was great, and I think it's just been. I'm leaving this call with so many just thoughts and questions. So thank you for initiating this.
thank you.
Yeah, it's a fantastic discussion, and yeah, I think have more of this. I think having these kinds of dialogues are great across sectors. Let's talk more about evidence. Let's talk more about what it means, how we can come together, how we can communicate it more widely. So yeah, looking forward to more from Uloy.
Super. Thank you. Thank you so much.